The Helderstroom prison in the Western Cape has been placed on a stricter lockdown. This after more than 150 inmates have tested positive for COVID-19. At least 8 officials there have also tested positive. Let's get the latest. Department of Correctional Services spokesperson, Mr. Singabakho Nxumalo, joining us now. Singabakho, good morning to you. Let's just first of all, before we find out what you're going to do to try and get on top of this, how do you understand 100 prisoners were infected with COVID-19? What happened at the prison?
A very good morning, and thank you for having us. When we received the reports that over 150 inmates have been infected at Helderstroom, it was clear that infection prevention control somehow may have been a cause to this. Hence, then we had to check if indeed everything was followed as per the procedures that we set out when COVID-19 came to the shore. And it was clear that I think there were gaps somewhere, and that is what we are addressing now. And we said something like this, should not just find it easy to happen in our correctional facilities because these are closed environments. Hence, then we said, but now our strategy catered for, to say, let us have prevention, but should there be a break there? Then we move to the second phase, which is containment and treatment. And that is where we are, making sure that we contain the center, hence the lockdown, that we treat those who have tested positive who require medical attention, and we monitor those who are positive. And also then thereafter we'll then move on to say, okay, what lessons did we learn from this? And these are the procedures that we're applying across. But for us as correctional services, it did concern us that such a big number of inmates tested positive, but we are now on top of the situation.
Singabakho, speak to me about these gaps that you're referring to. I'm asking because you're saying that lessons have been learned for the benefit of public knowledge. What do you mean by gaps? What do you understand actually went wrong?
When you get, let's say, one case or someone testing positive, you immediately go and embark on what you call track and tracing. How did that happen? And then you've got to pin that down to say, okay, this is the index case, and then if they say the area of infection is at the kitchen, you close down that area, you decontaminate, and you make it a point that whoever that went through that area, is immediately quarantined. That person then, if they are showing any symptoms, they get tested, and you also check who others who may have come into contact with those people. But in this instance, you find that more than 5 inmates working at the kitchen tested positive. Hence, then you have such a big number of inmates testing positive because they then had to then move to various sections of that center serving meals. And then they said, unfortunately, it took time for them to show their symptoms. Hence, then you have such now a big number of inmates testing positive. But then we said it's important that from time to time we do, do screening to a point that, we never take anything for granted. If a person has a cough, even if it's just flu, we take that seriously. Hence, then as a department, we said our screening on daily basis has to be rigorous, and that's what we've been doing. And hence, then we're even saying to other centers, make it a point that you don't take these measures for granted, to implement them, as we've stated, as the Department of Health, has guided us, so that to avoid a situation where you have big number of people testing positive.
I suppose the obvious question that many South Africans are going to ask, Singabakho, is prisoners aren't getting COVID-19 while they're in the prison. They're in isolation. They cannot leave the correctional facility. We're also reporting that at least 8 officials have tested positive. It is going to ask questions about the screening of the correctional services officials coming in and going out of these facilities. Obviously, they are now going back home to their family members. They're bringing COVID-19 potentially back to the correctional facility. How are you handling the officers involved at these facilities?
One thing you cannot avoid is that the virus is quite aggressive. It's within our communities, and our officials reside in those communities. They are likely to be infected, as when you check the numbers, the majority of people people who are infected is our officials. But then we said when those officials report for duty, it's important that you screen them adequately. But then in correctional facilities, now coming to your question, you have quite a lot of movement. People go to courts, others go to hospitals, so you've got to manage that as well. It's not an easy task, but it's something to say. If you follow the protocols that you've set in place, they should assist. Hence, then, thus far, you've seen that less than 3,400 inmates, have contacted the virus. It's because of the measures that we've put in place. Hence, then, even when you get 100, you say 100 may look small, in other people, but with us, it's a big number. Hence, that we've got to make it a point that we don't make it easy, for the virus, to go inside our centers and have widespread infections. Even with this particular case, we've said let us make it a point that infection prevention control, is strengthened, and also to say when people move in and out, you've got to screen them, even if they are moving in and out 20 times a day. It doesn't matter. So that at the end of the day, you're quite sure that whoever that is accessing, a facility, that person, may not have any trace of COVID-19.
Well, I appreciate your time in speaking to us. Identifying the gaps, it seems, and how to handle it going forward is Singabakho Nxumalo, spokesperson for the Department of Correctional Services. To remind you, Helderstroom prison, it's down in the Western Cape. They've been placed in a stricter lockdown. 150 inmates testing positive. And as I was asking Singabakho, the 8 officials also testing positive. How are they going to handle that? Of course, we'll follow up with that story as it develops.